To determine the correct panel size, take the circumference of the trunk at a level midway between the lowest ribs and the upper iliac crest. The brace is available in 2 belt widths with lordotic or non-lordotic back panels. Before application, remove the anterior thoracic extension and secure belt ends. If a fit tool is not available, fold each belt arm equally to achieve the desired waist circumference and secure the belt ends. Ensure the belt compression system is stretched to its full width. Log roll the patient onto their side. Ensure that correct spinal protocol is followed throughout the application. Position the belt by centering the posterior panel over the spine, with the bottom of the posterior panel approximately at the sacrococcygeal joint. Log roll the patient back into the supine position. Wrap the lumbar belt around the waist and through the Össur Fit tool. Adjust length of belt arms to position tool centrally. Secure the belt ends to desired sizing. If the patient's waist exceeds 50 inches or 127 centimeters, an extension belt can be added to each belt arm to reach a maximum belt circumference of 70 inches or 178 centimeters. Remove the fit tool from the belt. Place belt ends into the overlap closures. To obtain the lowest profile fit, the belt arm ends can be trimmed if later adjustments are not required. Take the anterior thoracic extension, center the anterior panel on the abdomen with the bottom edge just above the symphysis pubis, while still allowing the patient to sit comfortably. To adjust the height, push the button and slide the strut to the appropriate length. The superior edge of the pectoral pads should be located approximately 1 inch or 2.5 centimeters below the sternal notch. Use the provided tool, loosen the screw by 1 full turn, and then adjust the angle on the hinged adjustment mechanism to accommodate sternal contours. If the ATE needs to be taller, attach extension piece between lower strut and yoke. Fasten the non-labeled belt end onto the anterior panel and fasten the retaining straps onto the soft good. Close the belt. Slide fingers through the holes in the 2 compression system handles and pull until the belt is at the appropriate tightness. If necessary, adjust the compression system cord length. Connect both quick-release buckles and tighten the shoulder strap. Repeat these steps for the other side. The brace may require fine-tuning for comfort, fit, and stabilization when sitting, standing, or ambulating. If needed, remove alligator, trim the straps to length, and replace alligator. The Miami TLSO 464 compression system also allows adjustments by detaching the belt arms from the hook and loop strip posteriorly. Trimming the belts at an angle can give the opportunity to accommodate different anatomies.